Alright guys, so I'm going to start out with exercise and movement and just kind of give you a brief intro to that. So there's a significant number of studies in the literature that indicate that physical activity is neuroprotective, meaning it protects your brain. So we know that one particular area where things like neurogenesis and neuroplasticity still occur even in adults is the hippocampus. And the hippocampus is responsible for memory specifically. So we know that with exercise, you can get increased neurogenesis and increased neuroplasticity in that area, leading to improved memory. Other benefits of exercise include increased blood flow to the brain. More blood flow, more nutrient delivery, improved function. It also modulates the inflammatory process, and that can be measured with inflammatory markers. And there is an increase in brain-derived neurotrophic factor, BDNF, which is known to help with depression, and some medications cause increased BDNF, which we think is one of the mechanisms by which antidepressants and other medications might help with depression. So there's a lot here. Now, the exact adequate amount of exercise will vary in the literature. So how do I define exercise for my patients? What I'll tell my patients is that adequate exercise is anything that will sustain your heart rate for 30 to 60 minutes. So anything where you can get an increased heart rate for 30 to 60 minutes is considered exercise. Now that could be aerobic exercise or that could be anaerobic exercise, but I think when we're talking about the cognitive benefits, aerobic exercise tends to be better. There's a lot more studies indicating that aerobic exercise improves cognitive function in adults as they age, and will help prevent things like Alzheimer's dementia or major neurocognitive disorder, Alzheimer's type. So this is one of the benefits. Now, what I would say is that a combination of aerobic and resistance training is obviously best. And what we see for things like depression is that intervals of 45 to 60 minutes of cardiovascular activity or aerobic exercise, such as walking, running, etc., that tends to have the most antidepressant effect, things in that time range. And then when we talk about anaerobic activity like weightlifting or weight training or resistance training, we find that shorter intervals and higher intensity tend to improve mood more than lower intensity and longer intervals. So basically, take-home points here are, if you're doing a cardiovascular workout such as walking, you want to go somewhere between 45 and 60 minutes for antidepressant effects. And if you're looking for benefits in terms of antidepressant effects with resistance training, you want to go higher intensity and shorter intervals, so less time spent in the gym, which could be a good thing. So I recommend physical activity to all of my patients. I don't think there's any reason not to, unless there's a specific physical or health concern and reason why the person cannot exercise. Obviously, the earlier in life you start this program, the better it's going to be, but there's plenty of studies that have looked at benefits as we age as well, but there's no reason to wait. Start today, right? If you're having this situation, you can certainly start today. So there's physical and cognitive benefits regardless of your age. It does not matter. It's obviously much easier to begin training though when you're younger and you're healthier, and you can build that strong foundation and base. If you build healthy lifestyle habits early on, as you age, it will be much easier to continue them in the future. And in future videos, we'll dive into like specific programming and things and diets, etc. that I recommend. But for now, I think that's a good introduction to the exercise component of lifestyle modification in psychiatry.